Your patient is Mr. Rahim, 66-year-old male, came to discuss his problems with you. Please proceed with history and management plan. Examination is great.
Okay.
And 1 minute. Your time will be 9 minutes, 30 seconds. Okay. Time starts
Okay.
now.
Hello, Mr. Rahim. I am Dr. Sabah. How can I help you?
Doctor, actually, it's really embarrassing to share. I'm having this urine problem.
Okay. Can you tell me more?
Doctor, I am up and down all night to pee and it's getting really annoying. I'm going a lot of times toilet since last 6 months now. And I feel very much, I feel I have to strain myself and I don't empty myself completely.
Okay, I can understand that must be very difficult for you. Mr. Rahim, is that all?
Yes, doctor.
Okay, before we come to management part, I'm going to ask you a few questions. Is it okay with you?
Sure, doctor.
Okay. You said since 6 months. How it started? Start suddenly or gradually?
It started gradually. I was starting going 1 to 2 times in night, but now, doctor, it's really annoying me 3 to 4 times per night. I'm going.
Okay. Can you please tell me, is there any dribbling at the end of the urination?
Yes, doctor.
And you said there are nocturnal symptoms too. You have to wake up at night.
Yes, doctor.
Okay. And is there any burning with it?
No, doctor.
Okay. And do you feel any pain in your flank area, in your loin area?
No, doctor.
Have you noticed any blood in it?
No, doctor.
Okay. And have you noticed any pus in your urine?
No, doctor.
Okay. Do you have any fever?
No, doctor.
Any weight loss?
No, doctor.
Okay. Okay, Mr. Rahim, do you have similar problem in the past?
No, doctor. It's been just going on like 1 to 2 years, but now since last 6 months, it's getting worse.
Okay, okay, I can understand. It must be hard. Okay, do you have any history of long-term illness like high blood sugar?
No, doctor. I have just high blood pressures. I'm taking amlodipine for it.
Okay, and you're taking amlodipine daily?
Yes, doctor.
Okay. And how's your blood pressure control?
It's fine. I didn't go for a checkup in a while.
Okay. Do you have any history of uh, high blood fats?
No, doctor.
Okay. Do you smoke, Mr. Rahim?
No, doctor.
Okay. Do you take alcohol?
No, doctor.
Okay. And what is your weight according to your height?
It's 25.
Okay. And what kind of diet you usually take?
I'm taking normal diet, trying to eat balance, but I'm taking junk also.
And how is your water intake?
It's fine.
Okay. And do you like to exercise?
Yes, doctor, do daily walks.
Okay. Do you have any family history of similar illness?
No, doctor.
Okay. And Mr. Rahim, how this illness is impacting your life?
Doctor, it's just very embarrassing. I cannot engage to my friends again, and I'm really embarrassed. And it's really impacting on my sleep. I cannot sleep properly, and I'm worried about it could be a cancer.
Okay, we will definitely see about that. But Mr. Rahim, this is not embarrass at all. You took a very bold step, and it's important that you should see a doctor. Mr. Rahim, what is your concern? What is your concern in particular?
Only this, doctor. I don't want it to be a cancer.
Okay, okay, we'll definitely see about that. And what do you hope to get from today's consultation?
I just want some tests to rule out.
Okay. We will definitely talk about that. Okay, Mr. Rahim, I am going to summarize what you just told me that you have this problem since 6 months, and there's a more there's a urinary frequency, and there's a terminal dribbling, and there's a nighttime awakening, and your sleep is disturbed, and you're worried it could be cancer, and you want some investigation or medicine to rule out that it is not cancer. Is that all, or you want to add something else?
That's all, doctor.
Okay, okay, Mr. Rahim. Uh, uh, before coming to management part, I'm going to examine you. Is it okay with you?
Sure, doctor.
Okay, I'll start with your vital. I will take your pulse, your blood pressure, sitting and standing both, and I would like to look at your eyes for anemia and jaundice. I would like to check the lymph nodes in your neck, and I would like to do your abdominal examination. And with the in the presence of Chevron, definitely I will sanitize my hand, and then I will palpate your abdomen, superficial and deep palpation, and especially I want to palpate your kidneys and percuss and palpate your bladder. And at the end, I would like to do the DRE. Is that okay with you?
Sure, doctor. Okay, on DRE, prostate enlarged, smooth, rubbery, non-tender, no nodules or asymmetry, otherwise normal.
Okay. Okay, Mr. Rahim, the information you shared and the examination I performed, the most probably you are suffering from the condition, what we call in our medical terminology as benign prostatic hyperplasia. Do you know anything about it?
No, doctor.
Okay, Mr. Rahim, I'm going to explain it for you. There is a gland at the neck of at the neck of water bag. We call it prostate, and if that gland is enlarged, there is obstruction or there is a problem in the passage of urine. That's why you're getting these symptoms of increased urinary frequency, and there is a terminal dribbling, and you have to strain and having nocturnal symptom because of this gland. So I like to offer you few investigations. Is it okay with you?
Sure, doctor.
Okay, CBC with ESR, CRP. I would like to advise you abdominopelvic ultrasound, um, and I like to advise you PSA and urine routine examination. Is okay, any investigation available?
Okay, pending.
Okay, okay, Mr. Rahim. There are our investigations are pending, but still there are a few things which we can do. There are some pharmacological and non-pharmacological measurements, and you can start with the bladder retraining exercises. For that, I will refer you to physiotherapists, occupational therapists. They will teach you how to do it. You can keep the bladder diaries and you can have the record of this, and they will also teach you certain exercises. And um, and I will also refer you for urology consultation so we can get the better idea of what you're going through. Plus, also like to offer you a medicine called tablet doxycycline. I don't remember the dose. I will confirm it with formulary. Then I will tell you. Is that okay with you, Mr. Rahim?
Sure, doctor.
Okay. Is there anything else you want to ask?
Doctor, can I take a lot of caffeine?
No, no, you must reduce your intake of caffeine and especially your coffee and tea, especially at the evening time. It will definitely help you, and you should take less amount of caffeine.
Okay, doctor. And when should I come back?
Yes, if your symptoms get worse or there any new symptom develop or you see any weight loss or any blood in your urine, you should definitely seek immediate medical services and you should do follow up after 3 months. But it will definitely take some time to shrink the size of the prostate. It will take some time. So I will arrange your follow up after 3 months.
Okay, doctor.
Okay, thank you for your visit, Mr. Rahim.
Thank you, doctor. 20 seconds still remaining, so you almost finished your case in 9 minutes. Your next case is Mr. Hassan, 45 years old male, came to discuss his problem. Please proceed with history and management plan. Examination is gray. Your time starts again.
Okay, hello, Mr. Hassan. I'm Dr. Sabah. How can I help you?
Doctor, actually, this the weight is not leaving me. Like my weight is getting increase again and again, and I'm trying to control it, but doctor, I don't know what's going on.
Okay, do you want to add something more?
Yes, doctor, since last 10 years, I'm gaining weight, my clothes getting tighter, I'm sometimes breathless on stairs, and I cannot
Okay,
work properly in my desk job.
okay, I can understand that must be hard for you. Okay, Mr. Hassan, before we come to the management part, I'm going to ask you a few questions. Is it okay with you?
Sure, doctor.
Okay, since how long your weight is increasing?
Since 10 years.
Okay, and um, do you feel what kind of weather do you prefer?
Normal, doctor.
Okay, is there any is change in your bowel habits?
No, doctor.
Okay, and do you sweat a lot or there's some tremors and palpitations?
Only doctor is sweating. I feel sweaty a lot.
Okay, do you also notice that your hand and feet size are increased?
No, doctor.
Okay, do you notice any change in your voice?
No, doctor.
Okay, Mr. Rahim, do you have any history of any long-standing illness?
No, doctor, just this knee pain. I have this bad knee pain.
Okay, since how
And
long?
doctor, it's been like 5 years now. I was taking this Brufen for it. And yes, doctor, I snore at night also.
Okay, okay, okay. You snore at night. Can you please tell me more about? Okay, okay. Mr. Rahim, is there any episode of increased breathing and suddenly your breathing stop? Is someone your wife complain about it?
No, doctor.
Okay. Are you taking any medicine like steroids?
No, doctor.
Okay. Do you have any high blood pressures,
No, doctor.
high blood fat,
No, doctor.
any heart problem?
No, doctor.
Do you smoke?
Yes, doctor. I 10 cigarettes a day since 10 years now.
Okay, any intention to quit down smoking?
No, doctor.
Okay, if you ever made up your mind on quitting smoking, we'll definitely talk about that. I'll give you a leaflet and you can we can have another session about that. Do you take alcohol?
No, doctor.
Okay, and what is your weight according to your height?
33.
Okay, do you like to exercise?
No, doctor. I don't get time.
Okay, and what kind of diet you usually take?
Doctor, mostly takeaways. I'm not fond of vegetables, so I'm taking outside KFC and this and that. And also I'm taking this frizzy drinks, sugary drinks.
Okay, okay. Okay, Mr. Hassan, do you have any family history of similar illness?
Doctor, my brother has similar problem. He is also very fat. My sister is fat also. And my mom and dad, they are also. Nobody is thin in our home.
Okay, 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 Mr. Hassan, do you take any drugs over the counter or regularly?
Just this brufen, and sometimes it really bothers me. I get chest heartburn also.
Okay, I can see that. Okay, what is how this illness is affecting your life, Mr. Hassan?
Doctor, yes, I'm really embarrassed now. I feel like now I want to lose weight.
Okay, okay, definitely. And what is your concern in particular?
I'm just worried about any bad disease like my mother had diabetes, my father had heart attack. So, doctor, I just don't want to get that.
Okay, and what do you hope to get from today's consultation?
Anything, any injections that can slim me fast, any tablets.
Okay. Okay, Mr. Hassan. I'm going to summarize what you told me. You told me that you have this problem of weight gain since 10 years, and you have the busy job and you don't have a time to lose weight, and you also have the problem of knee pain for which you take Profen and you on and off, and you are worried about your weight because of some illness, and you want some injection for it. Is that all, or you want to add something else?
Only that, doctor.
Okay, Mr. Rahim. In order to confirm my diagnosis and before we come to the management part, I would like to examine you. Can you please come to the examination couch?
Sure, doctor.
Okay, I will sanitize my hand in the presence of chaperone. I would like to examine you. I will start with the general physical examination. First, I will do your vital, your pulse, your blood pressure, respiratory rate, and I would like to take your BMI. And then I would like to look at your eyes for any anemia, jaundice, and then I would like to take your waist circumference and um, and I would also like to advise you HbA1c and your fasting and random blood sugar levels. Um, and okay, please tell me any examination results available.
Okay, blood pressure is normal, central obesity, BMI 33, HbA1c is 6.3, and there is a hyperpigmentation on neck.
Okay. Okay. Okay, Mr. Rahim. The information you shared and the examination I performed, it most probably you're suffering from the condition what we called our medical terminology as obesity, and as you have already have a family history and um, you are worried that there could be some serious outcomes of this disease. I would like to offer you weight loss. You should lose weight. You can start with the you told me that you have a knee pain, then you can start with the brisk walk if it is comfortable with you, and then you can also do some other form of exercises like swimming or cycling or whatever you feel comfortable with. And you should concentrate on your diet. You should take low salt, low fat diet, and because increased weight gain can also put you at the risk of heart diseases, plus blood high. You can have high blood pressures, high blood cholesterol levels, and plus your HbA1c, which shows 6.3. It is already in the pre-diabetic level, and you are very much prone to have the diabetes, so you should control at this stage. Are you getting me,
Okay.
Mr. Hassan?
Yes, doctor.
Okay. We can also plan some session with there's some talking session with a counselor. They can also counsel you about the effects of this, and plus I'll also like to offer you metformin. We will start with a metformin tablet, metformin 500 mg once a day. This drug has some side effects, which can cause like GI upset, and they could be increased bowel movement initially, but we will definitely adjust up. It will only be in the initial stage, and then we can see if you lose weight, then we can consider about adding next drug. And okay, are you getting my point, Mr. Hassan?
Yes, doctor.
Mr. Hassan, the injections you're talking about, they have some serious side effects. And first, we will start with the lifestyle modifications. As I already told you, the weight and the diet and the drug I started. Then we will see about that drug because it definitely has some side effects. Are you getting my point, Mr. Hassan?
Yes, doctor.
Okay, I can also give you the leaflet about this obesity, which you can study and have.
Mhm. Okay. Just 1 minute. Your last case is Mrs. Jane, 58 years old female, came to discuss her problem with you. Please proceed with history. examination and management plan. Your time starts now.
Okay, okay. You said Mr. Jane or Miss Jane?
Mrs. Jane. Jane.
Mrs. Mrs. Jane. Okay. Hello, Mrs. Jane. I'm Dr. Sabah. How can I help you?
Doctor, I have this bad cough and I'm also having this pain on the side.
Okay. Can you tell me more about this problem?
Yes, doctor, since last 5 days I'm getting this bad cough, and when I'm coughing, I have this chest pain on the right side when I breathe also. Doctor, I checked, I'm getting feverish and getting chills.
Okay. Okay, Mrs. Jane. Before we discuss your management plan, I'm going to ask you a few questions. Is it okay with you?
Sure, doctor.
Okay. Since how long you're having this problem? You just cough.
Doctor, 5 days now.
Okay. And is there any phlegm with it?
Yes, doctor. It's green in color.
Okay. Okay. And what is the quantity of this phlegm?
It's not a lot, like little bit, whenever I
Okay.
cough.
Okay. And have you noticed any blood in it?
No, doctor.
Okay. And you also told me that you are getting a fever. Have you documented your fever?
Doctor, I didn't check, but your nurse told me that it's 38.7 now.
Okay. Okay, Mrs. Jain. You were also telling about that you have a breathing difficulty. It is always present or it comes and goes?
When I'm doing something.
Okay, Krishna. Okay. Okay, Mrs. Jain. Have you do you have any trauma recently to your chest?
No, doctor.
Okay. Recently, do you have any uh, viral flu-like illness?
No, doctor.
Okay. And how it started?
Just
Uh,
I don't know. I started feeling feverish and coughing, then this sputum.
okay. And is there any weight loss associated with this?
No, doctor.
Okay. And is there any palpitations?
No, doctor.
Okay. And is the pain only in chest or is going somewhere else?
Only on the right side when I'm coughing.
Okay. Okay, Mrs. Jain, do you have any past history of similar illness?
No, doctor.
Okay. Do you have any history of any long-standing illness like high blood sugar?
No, doctor.
Do you have any history of high blood pressure?
No, doctor.
Any heart problem?
No, doctor.
Any asthma?
No, doctor.
Okay. Do you smoke?
No, doctor.
Okay. Do you take alcohol?
No, doctor.
Okay. What is your weight according to your height?
21.
Okay. And do you like to exercise?
Yes, doctor. I go on daily walks and I'm having strict diet control. I'm trying to maintain myself.
Okay. Okay. I see. And what kind of diet you usually take?
Mostly vegetables, fruits, protein.
Okay. Okay. Good healthy diet. Okay. Do you have any family history of similar illness?
No, doctor.
Okay. Um, do you take any drug regularly or over the counter?
No, doctor.
Okay. Do you have any drug allergies?
No, doctor.
Okay. Okay, Mrs. Jane, how this illness is impacting your life?
It's just, doctor, I'm worried that this could be chest infection.
Okay, okay, we'll definitely see about that. And what's your concern in particular?
I'm just worried like it might be a pneumonia.
Okay. And what do you hope to get from today's consultation?
I just don't want any antibiotics. I don't want any admission, doctor.
Okay, okay, Mrs. Jane, I'm going to summarize what you just told me. You told me that you have the cough with the greenish sputum, and you have chest pain, which comes on breathing, and you also feel feverish, and you think it's pneumonia, and you want some antibiotic for it. Is that all, or you want to add something else?
No, doctor, that's all.
Okay, okay, Mrs. Jane. I would like to examine you. Can you please come to the examination couch?
Yes,
Okay, I will
doctor.
sanitize. I will sanitize my hand and then I will start with the general physical examination. I will check your vitals, your blood pressure, your pulse, respiratory rate, and your temperature. And then I would like to have a look at your face for any anemia and jaundice. I would like to check the lymph node in your neck. And then I would like to have your, in the presence of chaperone, I would like to have your chest examination. And for that you have to take off your shirt in the presence of complete privacy, of course. I would like to have a look at your chest for inspection, palpation, percussion, and auscultation in the front, on the front of the chest and also the back of the chest. And okay, that's it. Is there any examination?
Yes, heart rate 108, 38.7 temperature, respiratory 24, SpO2 94 on air.
Mhm.
Otherwise, normal, just reduced chest expansion and dullness to percussion over right lower zone.
Okay, and okay. Okay, Mrs. Jane, the information you shared on the examination I have performed, it seems like you have this condition. Um, uh, we can say it respiratory tract infection, and I would like to offer you few tests. Can I?
Sure, doctor.
Okay, I would like to offer you chest X-ray, PA view, CBC with ESR, CRP, sputum for cursor sensitivity, and sputum. Okay, and I would also like to advise you RFT, urea and electrolytes. Uh, that's it. Is any test results available?
Pending.
Okay, Mrs. Jane. From the information you shared and the examination I performed, it seems like mostly you have this condition, what we call respiratory tract infection, but I am not sure at this stage that it could be pneumonia. Uh, but I like to offer you antibiotic. We can start with the tablet clarithromycin, 500 mg once a day. And then we can also do some other things like a tablet paracetamol and 500 mg, two tablets thrice a day, and you have to take up plenty of fluids, you have to rest properly, and you have to take the good diet. And in case your fever does not settle, or your cough increases, or you have any difficulty breathing, or any your symptoms worse, you can immediately get to the medical services, or you can contact me, and we will follow up when the results of your test or your chest x-ray are available. Then we will review further to adjust over treatment. Is that okay with you, Mrs. Jane?
Sure, doctor.
Mrs. Jane, do you want to ask something else?
Actually, I got disconnected. What management did you do? What antibiotics did you give any?
Okay, I started with the atypical. I started clarithromycin and um, 500 mg I started. Then I gave a tablet paracetamol to a 500 mg, two tablets thrice a day. And I advise rest, plenty of fluids, a good diet, and then I offer a follow up if the condition person. And I will review. Sorry, that was safety meeting. I will review the patient after when the chest X-ray and the lab results are available. Then I will review her again in less than 48 hours.
Okay, doctor. So you still have 1 minute. Do you want to say anything?
No, I think I'm pretty good.
Okay, so your case done. Let's start from the first case. First case was BPH. Straightforward was 66 years old, Mr. Rahim. You asked about the red flags. You asked about the DDs, but two important things: bone pain because of his age and suspicion of cancer. We need to ask bone pain and any neurological signs, any new neuroscience like any new weakness in your body.
Mhm.
Okay. Otherwise, you were patient centered. Your history went up to 5 minutes, 15 seconds. And you did examination, then you did PSA levels. So after DRE, we are not going to do PSAs. So you can
Okay, okay.
verbalize that after 2 days,
Mhm,
I will be running your another test. We call it PSA. Right now,
mhm.
on the findings, what benign prostatic hyperplasia, non-pharma. In this case, non-pharma is important. You touch
Okay.
non-pharma, but mostly you send for the physiotherapy and exercises. But here, what we
Mhm.
can tell him, firstly, reassure the patient that it is not cancer. Okay. And
Okay.
secondly, for with lifestyle and medication, we can control your condition. And if the patient is a lot embarrassed there, like maybe he's depressed because of his condition, so we need to screen for depression.
Okay, okay, okay.
Okay, if he's low moods and he has lost interest in daily life activities, but if he seems depressed over there, otherwise
Mhm.
lifestyle will be reduced evening fluids, time voiding, double voiding. This one word is very important in BPH cases, double voiding before going to bed.
Okay,
Okay, and if patient is taking decongestant or antihistamine, tell him to try avoiding it.
okay.
And also the medication you give, tamsulosin, right?
Yes.
We mostly offer it zero point 0.5 milligram at night.
Okay,
And other medication you can tell, but you have to just start tamsulosin and lifestyle and reassess in 4 to 6 weeks. You almost did the same, just a little bit of non-pharma should be told more. Safety
okay.
netting, I guess you missed safety netting.
You know, I said if the symptoms worsen or you have developed any new
Yeah.
symptom, blood and your weight loss, then please come see me.
Okay. Okay. So your next case was Dr. Sabha, and one thing I'm noticing, we cannot say over there, you should or you have to. These two words, we need to be very careful.
Okay,
We can say, is it possible for you? Can you do that? How about that? Things like that.
okay,
Because South Asian exam, they have some kind of this criteria we cannot impose on the patient. So should have to, we need to remove this.
okay,
Second case was obesity, and I'm glad you didn't say it metabolic syndrome because he doesn't have anything else except the family history and obesity with just pre-diabetic. So it's not even three of the criteria that needs to be metabolic. So it is just obesity case. Um, he started on metformin, even though he's pre-diabetic. Uh, I'll tell you a little bit about it. You ruled out OSA, you ruled out hypothyroidism, you ruled out fatty liver very nicely. All differentials was asked. Red flags about breathlessness or any chest pain can could be asked in this case.
mhm,
And
okay,
yeah, diet exercise for first 3 months, we will ask the patient to do proper diet, activity, and exercise. Uh, Activity or any kind of exercises, anything that he enjoys, but should be physically. And
okay,
since he is afraid that he might get heart attack, we can take his concern as a imposing factor. Like, so Mr. Ahmad, you think as you already afraid of getting heart attack like your dad, so it's very important for you to start on the management plan by changing your lifestyle. Firstly, diet, then doing exercise. And exercise, we have to say 150 minutes of vigorous exercise in week or 70 moderate exercise or 75 minutes of vigorous exercise in a week.
okay,
And we also need to say here, like, if you decrease only your 5 to 10% of your weight, then it will markedly increase your safety from any heart and heart issues or diabetes. Okay, 5 to
okay. And we can
10%.
also refer this patient to dietitian also.
Yes, here we will give proper dietitian referral. They will give him a reduced calorie diet, and you can tell him we need to decrease your calories up to 500 to 600 because he doesn't have any other comorbidities, so we have to address it in detail, like diet for 600 decrease calories in a day, physical activity, what behavioral strategies are important, food diary, planning the meals, avoid shopping when hungry,
Okay.
and then social support, and also screen for
Okay.
depression in these kind of cases also if he is depressed.
Okay.
And after 3 months, we can start on the other medication, early stat or any
Yes.
GLP-1 analogs, but still, uh, um, according to the local guidelines.
Okay.
Review in 3 months.
Okay.
And safety netting again, chest pain, etc. Third was lobar pneumonia. I noticed in this case you asked about differentials and red flags nicely, but when the patient is already telling you one thing, doctor, I have this for 5 days, again, if we ask, it will take our time, right?
Okay.
So he already,
Okay.
she already told you like 5 days, so we try to like avoid re-asking the patient.
Okay.
And palpitations, it's better if we ask racing and pacing of heart.
Okay.
Otherwise, this was lobar pneumonia. Patient wasn't having any past medical history, just a chest infection. SpO2 is not like quite normal. Don't need to put her on oxygen, but has high grade fever, so we can start on the antibiotics. Since only right side, lower side of the right lobe is affected, this is lobar pneumonia most probably. So
Okay,
we
but I was
start with the
confused
typical.
whether we have to say it a pneumonia because on auscultation you didn't tell me is there any bronchial breathing or something, crepes like that. So I was confused. It could be overlapping with lower respiratory tract infection, or is it safe to say pneumonia without chest X-ray at this stage?
Kind of, yes. Because in the lower respiratory, mostly pneumonia comes.
Okay.
Okay. And the differential could be ILD, COPD, and any cancer. If there is a, they are telling you one finding on the right, lower side, there is decrease. What did I tell you? Reduce expression and dullness to percussion over right lower zone. So it was area bounded, right?
Okay.
So mostly pneumonia we can address here.
Definitely pneumonia there. Okay.
Start on the amoxicillin or doxycycline if she is allergic, paracetamol or brufen, and safety netting. And review in
Okay.
48 hours, very important. Follow up should be in 48 hours. So these were all your cases for
Okay.
today.
Thank you, Dr.
Okay.
Masara.
Thank you, doctor. I guess the other doctor is not available, so we will be stopping over here.